Every morning, as the first rays of sunlight touch the earth, children like Aisa set out on their journey to fetch water from the river. What seems like a routine task harbors hidden dangers. Unknown to them, the tranquil river hides a menace. Schistosome parasites that invade their bodies, causing schistosomiasis. Schistosomiasis drains vitality and disrupts lives. In the Gambia, it poses a significant public health challenge, particularly in rural areas.
In 2015, we did a countrywide mapping to look at the burden of schistosomiasis across the country. Because if you want to do an intervention, you have to do a baseline study to know the problem, the magnitude of the problem. So when we did this mapping, cumulative as a country, we had 4% as endemicity. But when you trickle it down to the regions and to the districts that we are treating now, because like this specific campaign, we are treating 27 districts across the country. We've got more than 10% endemicity in all those 27 districts, and that's what is warranting us to conduct this mass drug administration to prevent people from becoming infested with those parasitic worms that cause schistosomiasis.
The Ministry of Health of the Republic of the Gambia has launched a comprehensive mass drug administration program to treat and eventually eradicate schistosomiasis in 4 rural regions.
The exposure is through drinking contaminated water and being inside contaminated water. So if the worms are inside contaminated water and you go, sometimes they burrow through the skin and sometimes we drink them inside the water.
All the villages we've gone to, we've visited, they have come out to take this the praziquantel that we are given to prevent them from the schistosomiasis. We always explain to them what is the essence of taking these preventive medicines, because it's very, very important. You don't just jump without sensitizing the people, especially when it comes to the people around here. We first sensitize them and then tell them the benefits of taking the praziquantel to prevent them from schistosomiasis.
The MDA program involves administering praziquantel, a safe and effective drug, to entire communities. Health workers are mobilized across the rural regions to ensure no one is left behind.
The feedback we are getting is very impressive. Myself, I've been in the field since on Sunday trying to follow the teams to see what is happening and to know whether they have some challenges or see how best I can support them in the field technically. Because it's the best way to supervise is to follow teams in the field and know their challenges and try to solve them right on the ground. So the feedback we are getting is very impressive. Just any drug that you give, even though this particular drug that we are giving, praziquantel, is very safe and is reliable, but it does not come without side effects. And this side effect is basically most of the time it shows that those people are infected with those parasitic worms, because once you have the worms in you, if you take the medicines, immediately the medicines react in your system. That's why people will vomit, they will feel dizzy, or they will have abdominal cramps. But what we want to tell people is that is a positive sign, because it shows that the medicine you are taking is effective. That's why you are feeling those kind of reactions.
I even took the vaccine, but I saw that it started giving me a bit of headache, bit of dizziness. These are some of the side effects. Others, it gives them vomiting. Some of them, it gives them stomach upsets, including diarrhea and the likes. These are some of the...
Any medicine you have seen, there are some side effects, and praziquantel is part of those medicines that you will expect the side effects. But what is important is, let's weigh the two, the benefits and the side effects. We realize that there are more benefits because, as I said, Schisto is endemic in CRR, and I can mention communities where you know that the prevalence in those communities is very high. Like you go around the Nyani district in Jakaba, or even the lower Fuladu district in Jahali, where we are having, a lot of confirmed cases going by our records. As you all know, the surveillance officers in districts are giving us weekly reports, and these weekly reports are coming from health facilities and also community clinics. And these are areas where you know that we are seeing most of our cases. So if this campaign can be a success, definitely it will reduce the burden as far as schistosomiasis is concerned in Central River region.
Anyone who knows URR, the geographical location, you will know Upper River region is an endemic area for schistosomiasis. Myself, especially when I was in the field, I've seen a lot of cases of schistosomiasis in URR. So the campaign in URR is really very important because we know it's going to be both the treatment and then prevention of individuals, especially people at risk to schistosomiasis. So this mass drug administration will help to prevent the population from schistosomiasis.
Special emphasis is placed on school and communities as children are particularly vulnerable to infection. By treating children, we improve their immediate health and future prospects.
am nañ si kontaan trop parce que man maa nekk village health workers bi gars yi dañu ma call gars yi ñu ne ma xaw ma ñu ngi am garab bu ñu war a indi fii nii pour ma tasaare xibaaru bi si biir dëkk bi waaw ma ne leen incha allah taala loolu du nekk problème loolu itam ma itam yàlla may ma kattan ma tasaare ko si biir dëkk bi yëpp si góor yi ak si jigéen ñi yëpp waaw yëpp ma xamal leen daal comme gars yi ñu ngi ñëw fii daal di indi fii garab boo xam ne nii garab bi kaliya la daal pour dimbale doomi aadama yi daal incha allah.
This campaign is very important. One, because we want to protect the communities and reduce the burden of disease, specifically in the 6 most high-risk targeted regions in the country. And we also want to participate in the fight towards elimination of schistosomiasis.
I just want to assure the general public that these medicines are safe and they can always take it, and we are always available as Ministry of Health to address issues with regards to multi-drug reaction, because we know people's body systems are not the same. So if one may take the medicines and have some mild symptoms or other reactions that within 1 hour, those usually they go away. But if you are not sure, we can always come and assure the individual. So I just want to assure everybody that these medicines are safe and they can be taken anywhere and at any time.
Despite the success, challenges remain. Community engagement and education are crucial for high compliance rates.
We're having a very good response from the community because, in the community, we were having challenges in administering some of our indicators. But when we go around this time, we told them that we have a drug that will help you from schistosomiasis and some worms. They are very, very willing to come. You can see kids are coming, even the elderly people are also coming, and then they are all taking this medication. Right now we are having a very good turnout and coverage for this campaign.
The impact of mass drug administration programs is already visible. Communities are seeing a reduction in infection rate and an improvement in overall health. The fight against schistosomiasis is far from over, but with continued efforts and the resilience of affected communities, a healthier future is within reach.
Generally in the communities, we are not seeing much resistance. People are really accepting it because they know when you take this drug a day, the following day you start seeing the effect in the feces. You can see remnants of the worms in the feces. So for that being the case, this is what is assuring the committee member, and this is why they are coming in their large number, and are taking the drug, as well as in the school also is well accepted anyway.
Join us on this journey. Together, we can eradicate schistosomiasis and ensure a healthier future for all.
Let us all join together in the fight against schistosomiasis by partaking in the treatment, in the mass drug administration. We would like to ask communities to please volunteer to go to the health workers who are in the communities to take up the treatments and hopefully to reduce the burden of disease in the community.